Good afternoon, everyone. My name is Melanie Stargell. I am the Health Programs Chair at the DC Metro HBCU Alumni Alliance, and I want to welcome you all to today's panel session, a conversation about high blood pressure, stroke, and dementia in Black men on World Hypertension Day. On behalf of the DC Metro HBCU Alumni Alliance and the National Institute of Neurological Disorders and Stroke, part of the National Institutes of Health, we'd like to thank you for joining us today to commemorate this important Awareness Day. This topic is very important and personal to our organization. The health disparities that exist between African Americans are alarming and have long-term consequences for quality of life and life opportunity. To increase awareness and education about the prevention of these conditions, the DC HBCU Alumni Alliance established an annual HBCU 5K Run Walk and Alumni Community Day to bring awareness to these disparities, deliver education, and offer health screenings. This health initiative aspires to educate the community on living well, with regular exercise and proper nutrition, and draws attention to the barriers that many people in our communities face in making healthy choices. I'm honored to join in this effort and am looking forward to our conversation today. In this afternoon's discussion, you'll learn about an important health issue that affects Black men, high blood pressure, which, if left unmanaged, can lead to stroke, heart disease, and dementia later in life. High blood pressure is more common among Black adults, and more men have high blood pressure than women. Today, you'll hear from panelists who will share more information about the link between high blood pressure, stroke, and dementia, risk factors for Black men ages 28 through 45, and more importantly, actionable steps and helpful resources from the NINDS Mind Your Risk campaigns you can take away from this session to stay healthy. You'll also hear personal stories from two of our fellow DC HBCU Alumni Alliance members that we hope will offer inspiration. So without further ado, let me introduce our panelists. Our first panelist is Dr. Richard Benson. Dr. Benson is Director of the Office of Global Health and Health Disparities at the National Institute of Neurological Disorders and Stroke. He is a leader in the fields of vascular neurology and health disparities research. His areas of research interest and expertise include health disparities and health equity research in minority, community, and global health. Our next two panelists, who are both dedicated and passionate members of our Alliance community, are Eric Hodges Jr. and Dr. Akenna Myers. They are joining us today to share their own personal health stories with you. Eric is a Prince George's County, Maryland native and is the founder and developmental director of the Rose Project, a community youth nonprofit organization that empowers youth to make life choices that positively impact their future through community-based mentoring and extensive training. Dr. Akenna Myers is an internal medicine physician and certified diabetes educator and is currently the clinical program manager for the African American Health Program at the Department of Health and Human Services for Montgomery County, Maryland. He previously served as clinical operation director at Healing Our Village of Maryland, a community nonprofit focused on health disparities, wellness, and health education in underserved communities. Now, let's dive into our chat. I'd like to invite Dr. Benson, Eric, and Dr. Myers to join me on camera now. How are you all doing today?
Hi, Melody. It's truly an honor to be here with you today and to participate on this distinguished panel.
Thank you.
I'm doing well. Thank you for having me, Melanie.
Thank you. Thank you. And Eric, how are you doing today? Oh, Eric, you are on mute. There we go.
Good afternoon, everyone. Thank you for everything.
Thank you. Thank you for joining. Well, the first question I'd like to kick off is for Dr. Benson. Dr. Benson, you just heard me briefly mention that Black men have higher rates of high blood pressure and are also less likely to have blood pressure under control. Many people tuning in today may not be familiar with what exactly high blood pressure is. And so can you please help our viewers understand the basics?
Yes, well, that's a great question, Melanie. So your body is like a closed system. You have your heart, which pumps blood throughout your body to your organs through the arteries, and then the blood, after it leaves the organs, it goes back to the heart to receive oxygen through the veins. And so when the heart contracts or it squeezes to push the blood out of the heart, it creates pressure in that arterial system. And that's sort of the maximum pressure in that system when it's contracting. And that's sort of the top number or the systolic number. And that number should normally be less than 120/80. And then when the heart is relaxing, the pressure in that arterial system goes down, and that creates the lowest pressure in the system. And that should be less than 80. And so as the heart contracts and relaxes, pumping blood throughout the body, it creates that blood pressure of 120/80 in terms of the normal values.
Okay. Thank you. And so how does high blood pressure lead to other health problems like heart disease, stroke, and dementia?
Well, there was a study called the SPRINT study that actually looked to see what's sort of the best blood pressure in terms of decreasing the risk of these really major negative outcomes like cardiovascular disease, stroke. And they looked at keeping the blood pressure less than 140/90 versus 120/80. And what it found was that people who had the lower blood pressure, less than 120/80, had less cardiovascular outcomes such as heart attacks, had fewer strokes, and also had lower cognitive impairment or dementia later in life. And so when your blood pressure is elevated like that, it creates pressure in the walls of the arteries, and that leads to what we call hardening of the arteries or atherosclerosis. And that raises the blood pressure. Also, clots can form and damage to the organs. And all of that occurs with high blood pressure, as well as strokes in the brain and dementia.
Thank you. And can you share why Black men ages 28 through 45 are at a greater risk?
The issue is the period of time. So if you have someone that has high blood pressure, 28, and it's not uncommon to see someone in their 20s to come in with elevated blood pressure, particularly in the African-American community. If you're 28 years old and you live another, 30, 40, 50 years with your blood pressure uncontrolled, you have a longer period of time to develop damage to the arteries, damage to your organs, and that puts you at higher risk for heart attack, stroke. And as this study found, it also puts you at risk for dementia or cognitive impairment. This study actually was the first study to show a modifiable risk factor for dementia. And we can hopefully talk about what dementia is later on, but having that long period of time of uncontrolled blood pressure and what we call midlife from 28 to 45, it increases your chance of having, in addition to a heart attack and stroke, and we know those are bad in terms of major causes of death, but also it increases your risk for dementia as well.
Thank you for that background, Dr. Benson. Eric and Dr. Myers, again, we are so grateful to have you here today to share your personal experiences with high blood pressure and stroke. Could you both tell us a bit about your stories and why this topic is so important to you all? And I'll go ahead and start with Eric.
Okay, this topic is really big in the African American community. It's a real personal thing to me because there's a lot of people in my family that deal with blood pressure. There's a lot of people who are out here in the world who don't know that their blood pressure is elevated, just like I didn't know that my own blood pressure was elevated. Mine came at a time when I had a really bad head-on collision car accident, and my pressure was elevated to, I believe it was like 216 over like 130. And I have always been athletic all of my life since the age of 7. And it was the most scariest thing that I've ever had to experience with trying to monitor it, because there were days where I would have these episodes. And like Dr. Benson said, you could have cognitive issues. And I was experiencing a lot of that. I would, fall asleep uncontrollably, not being sleepy. I would not remember things. I would forget that I went to the bathroom. I would forget that I had to pay bills. And that's not a good thing because it leaves you behind in a lot of different areas. And I would like to say that also that we also need to check who our doctors are, because I had physicians who were not in the African American community at the time, and I don't think that they took it as serious as I did. So that's my personal talk on it.
Thank you, Eric, for sharing that. Thank you. And Dr. Myers, I'll turn it over to you.
Thank you, Dr. Benson. Thank you, Eric, for sharing. I first want to thank DC HBCU Alumni Alliance and National Institute of Health, National Institute of Neurological Disorders and Stroke for creating this amazing platform to share on such an amazing topic, especially among Black men 18 to 45, which is a really important age group to talk about preventative health. My story is definitely personal. My paternal and maternal grandfather, as well as both of my uncles on my mother's side, suffered from hypertension as well as diabetes. The complications of which for my paternal grandfather worsened as he aged, and he died from the complications of a stroke. Much of my current work as a public health professional and advocate is centered around educating Black men as a whole about the benefits of preventative health and surrounding hypertension and stroke. And so I'm really happy to be here. Anytime I go home, it's always about bringing my blood pressure cuff and things home, because my father, and I hate to throw him under the bus, refuses to go to the doctor. And so I'm always taking that home just to do the basic services so we can get a baseline to make sure his numbers are below the 120/80. So that's my story.
Thank you. Thank you, Dr. Myers, for sharing. It's so inspiring to hear about both of your health and wellness journeys, just for yourself and for your families. And so can you share a little bit more about the steps you took to improve your health today and for the future?
Absolutely. Yeah, I'll go first. So the first step, I believe, is getting a primary care. And so I'm really glad that Eric shared that, because, finding a primary care physician that I felt comfortable talking to and that looked like me was my first step. And it should be the first step. Then getting a yearly physical exam so that I can get some baseline health numbers so I know where I stood as far as how healthy I am and where I need to go. Getting to know your ABCs, and that's your ABCs of health. So, your A1C, your hemoglobin A1C, which measures the amount of glucose that's in your blood, and that's used to diagnose diabetes. Your blood pressure would be your B, and then your C, your cholesterol. And then exercise, nutrition, and stress management are going to be our third. So, for exercise, it's just, for me, it's more about moving. I don't have to be on LeBron James' workout plan. Nutrition is just staying away from fast foods and processed foods, eating more whole foods, and then reducing stress. Whether it be, yoga or meditation, or, just exercise, and then getting as much sleep as I can. That's really my go-tos.
Thank you. And Eric, what about you?
So my situation is I refused. I fought back a lot when it came to treatment because I've never wanted to take medication. As a child, I had, bad asthma and bad allergies. So that was enough for me. And, medicine just is not good for me. The treatment plan that I was given, like I said before, I didn't have anyone within my community that could tell me more about it or how I could, devise a better treatment plan. But there was a medication that I was given that basically made me feel dizzy. And I couldn't even go up a flight of stairs or go up the escalator to get to work. So therefore, it was threatening my own career because I couldn't focus. So within that same visit, I was made aware of being pre-diabetic, and that's when everything broke me. So I pretty much had to buckle down everything. I had to go back to my old ways of, trying to work out, trying to do things that I needed to do. But then also, I had a slip and fall, which was a freak accident 30 days after I had a car accident. And I ended up having an amputation to my left big toe due to the lawnmower injury. So that just added more stress to the situation. I believe the financial strain was also another thing. And then also sometimes I believe it can be in our environment because there's a lot of people in our community who are not in a position to, have a deep and stressing over things like money, trying to take care of your family and things of that nature can also add to that stress. And sleep was a big thing. I would try to work multiple income situations and, to make ends meet. And it's not like, you know, most of our community is not doing this, but also we're making the money, but we're also going to be spending that money later on with treatment because we're not getting enough sleep. And for someone who's played sports since I was 7 years old, I never knew that if you didn't eat your sugar spike. I never knew that, if you didn't sleep right or get a certain amount of sleep, that you would, have these cognitive issues and, produce blood pressure issues and strokes and things of that nature. And I've seen this in my own family, but I never tried to worry about that because I've always been fit and tried to stay active. But it can happen. And when it does happen, I encourage all of my friends and anybody out there to make sure that you go to the doctor and you know your physician personally, because that is going to be your best bet.
Thank you, Eric and Dr. Myers. And Eric, you kind of went right into what I was going to talk about next. And we're all human. There are obstacles that happen when it comes to managing our health in our day-to-day lives. And so, Eric, I know you've already begun to share. And so, for Dr. Myers, can you share some of the challenges that you faced in managing your health? And it sounds like managing the health of your family members and how you've overcome them.
Yeah, absolutely. So much of the challenges I've had faced really more center around me as a public health professional. But then also, I guess it does translate over to my father because it's the exact same. And it's more about getting men to care about their health choices before it's too late. And I believe that comes with more education about normalizing preventative health and changing the normalization around what it means for men and Black men especially to work until you drop, despite being in the face of extremely negative life work balances and circumstances. It's sort of like the idea of John Henryism, right? So Black men often feel they have to work hard, no matter what, and not seek help and not seek care and not do these things and take care of everybody else except for themselves. And that's normal, right? And so, looking at that, examining that, also looking into the fact that just the social determinants of health and what surrounds those, because those are, if they affect, especially as the persons that provide for the family. We can look at John Henryism as an example, a study done on Black men and Black families as one of those. So those are some of the things, but as it translates to my family and my dad, checkups and things like that has definitely been a struggle. Educating him on the benefits of that. I've seen personally just in him some complications. He's an individual by all when you look at him, but complications don't just stay in there, right? They affect, hypertension, diabetes, things. They can affect your teeth. It can affect your oral health, right? It can start to affect other parts where you can't necessarily see, but you can see, and things like so. Talking to him about those things and making sure he's staying on top of that has been my struggle, and I'm hoping to do better and affect change population level as well.
Thank you, Eric and Dr. Myers. And so, Dr. Benson, are there any other steps that Black men can take to help lower their risk? And what tips do you have for our viewers tuning in today?
Well, thank you, Melanie. Another excellent question, and I'm really humbled here as a federal medical health provider to hear these stories. Eric and Dr. Myers, you actually gave some really compelling stories that I'm sure happen and impact a lot of people. So just having Black men have this kind of conversation is very important. We have to normalize being able to talk about our health and sort of get rid of that John Henryism that you talked about, Dr. Myers. And so I think, Melanie, most of the points were sort of mentioned. The American Heart Association has something called Life's Simple Eight that they talk about. And I think all of the points have been mentioned in terms of losing weight, having a healthy diet, getting 5 to 7 servings of fruits and vegetables a day, exercise. We should do 20 to 30 minutes of physical activity at least 3 times a week as a minimum. So that's a minimum of 20 to 30 minutes 3 times a week. So physical activity, losing weight, getting your weight down. Smoking is bad. You just have to stop smoking. And then get your blood pressure under control. If it's not under control, that means working with your medical provider. There are disparities. This was mentioned, Eric and Dr. Myers mentioned that. But making sure you work with your medical doctor and get on a medical regimen that works for your blood pressure, getting your blood sugar under control as well. And Eric mentioned that, and getting your cholesterol under control. And the last point that Eric mentioned, the 8th thing as well, is sleep. It's important to get enough sleep. We know that people, as you get, as people are maybe more overweight, you tend to have obstructive sleep apnea, and which impacts your sleep, and that leads to excessive daytime sleepiness. And so we know treating OSA, or obstructive sleep apnea, can help to lower your blood pressure, your diabetes, and your cholesterol in people that have difficulty controlling it with their medication. So getting enough sleep is also important. So those are the things. And then self-monitoring your blood pressure. People that know your blood pressure, if you know your blood pressure numbers, you'll get it under control. So go buy a blood pressure cuff. There are automated blood pressure cuffs that you can buy, and check your blood pressure, write it down so that you're following it. And then you can take that and show it to your medical provider and work with your provider to try to get your blood pressure under control.
Thank you. And you mentioned blood pressure and monitoring your levels regularly. And can you elaborate a little bit more on why that's so important? And then do you have any tools or apps or devices that you'd recommend to people to self-monitor their blood pressure?
It's a great question. And you can't change your numbers if you don't know the numbers. So just knowing the numbers makes a difference. So if you check it and it's high, and Eric mentioned some really high numbers in terms of where his blood pressure was. But if you know what it is, at least you know where it is, and then you can work to modify it and to change it. You can find a blood pressure cuff. It's important to monitor it properly. They're automated. Put the cuff on your, there's some where you can monitor it with your wrist. I really like the ones that go around your arm. And you sit down, and the cuff should be at the level of your heart. Both of your feet should be planted on the floor, and you're sitting down in a chair and relaxed. And then you must measure your blood pressure and write it down. There are apps where you can track it, and some you can actually send it electronically to your medical doctor. But others, I think you can keep it in your phone, your smart device, and print it out. And if you go to the NIH Mind Your Risk website, and we'll give that out a little later, www.mindyourrisk.nih.gov. We have materials where you can actually write down your blood pressure, your self-monitored blood pressure numbers, and take it to your medical doctor. And once a day is enough, because your blood pressure once a week is enough, because your blood pressure fluctuates throughout the day. And so I think just checking it once a week, I think, is good. And so, yeah, I think I answered your question, Melanie. That was a great question.
Yes, you did, Dr. Benson. Thank you so much. And so for Eric and Dr. Myers, have you ever tried self-monitoring your blood pressure at home? And if so, what was that experience like for you?
He said only once a week. I do it like twice a day.
Okay.
I'm very cautious with stuff. So, not being used to having to take blood pressure medicine, I only take one now. And the number isn't as high anymore, but it's low. It's low enough, but it's still not where it's supposed to be. I forget what stage they say it's in, but it was like between like 139 and 188, something like that. But I want it lower. But yeah, I check it about twice a day. I do have an arm cuff. I recommend the arm cuff better because I've had faulty readings on the wrist, and I think I got that from the doctor when I first started. But I try to walk regularly, exercise. I use the Under Armour map from the application on your smartphone. And I challenge my other friends, because I know some of them are overweight, some of them are father figures who are, providing for the home. So it's hard. And I think as you get older, that's when a lot of the issues come because we're not as active as we used to be. And I know I'm not as active as I used to be. I play sports on the weekend. I mean, I walk probably 4 or 5 miles a day back then. So, I'm 37 now. That's when I was 29. But at the same time, I'm still trying to get back to that and remove that medication because I don't want it.
Okay. Thank you. Thank you. What about you, Dr. Myers?
So I don't check it as much, but I do check it probably about once a month. And generally when I do, I check my numbers twice during that time and then average the score. And then we often do screenings here with the groups that we do. But yeah, it's definitely something that we need to continue to do. And Dr. Benson, as you mentioned, writing them down is really important. Keeping a record and log is probably the most important.
If I can expand as well on Eric's point, I think in terms of the medication, I think that's a really important point, particularly with African American men. There are a lot of different blood pressure medications out there that have side effects. And so it's important to take the medications as prescribed. If you start to experience side effects, to have this conversation with your medical provider, because there are good blood pressure algorithms out there. And we suggest that all medical providers have a blood pressure algorithm that lists different categories of blood pressure medications. And you can switch between the categories of medications. And then there's combination medications out there that don't have those effects. But I think one major reason that people don't have their blood pressure under control, besides having a poor diet and not exercising, is that people actually stop taking their blood pressure medication. And so I think that's a great point. And so that's one suggestion. I think that's a very important point, Eric, that you brought up. But I think it's important to work with your medical doctor and just have that discussion. Just, hey, I'm having these side effects from this medication. Is there something else I can take? Or if it's just a matter of not wanting to take a pill, that's a whole nother thing. As you get older, unfortunately, you may have to take a pill. If it's not causing any effect, then that's good. But if you are having effects, I think you should discuss that with your medical provider.
Yeah, until this day, I never knew that until you said it. Mm-hmm. Of course, I wasn't in the right space, but at the same time, everything was trial and error. And the first time it was like a huge dose because it was so high at the time. So I think it was like maybe 40 milligrams. And yeah, I probably couldn't see this room right now.
That's a good point. I'm sure Dr. Myers can talk about this. When you start to think in terms of health disparities, that sometimes certain groups, particularly African Americans and African American men, you don't want to be that vulnerable in front of your medical doctor sometimes and say, hey, this is not working. And, is there something else I can take? Or this medication may be affecting my potency. Is there something else I can take? And so I don't know if you want to comment on that, Dr. Myers, but I think that unfortunately leads to the health disparities that we talked about. Just some of the things that you mentioned, Eric.
Yeah. I mean, so this kind of speaks to that in the medications. I was just talking to an older gentleman who was taking his blood pressure, and for a long time had been searching for a cardiologist that looked like him, that he was comfortable talking to. I mean, he's probably about 85 at this point. He was starting to regularly check his blood pressure. His blood pressure turned out to be around 80 over 50. And, because he had been taking his blood pressure for so long, he had stopped, he's kind of like, I don't want to take it anymore. He got to that point of miseducation and kind of like, I don't want to do it anymore. In addition to, I don't have a physician I'm comfortable with talking to. So he just stopped. And so he started asking me, should I take it? Should I take it? And finally found a physician that he's comfortable talking to, who was able to get him comfortable, get him able to engaged. And he was finally able to tell him, okay, yes, get him able to say, no, you don't need to take it. Here's why, here's the plan, here's what you need to do. And now we can comfortably move forward in health. And so, it's about addressing all of those aspects, the medication, the history of not having of dealing with a medical mistrust system that's been around, especially for possibly older adults, and then possibly even having a healthcare team that includes a pharmacist could possibly also help as well. And there's a lot of resources out here that can help you navigate not only the medicine system, the healthcare system, the medical insurance system as well. The NIH has some, I know, as well as another number of county spaces.
No, those are great points. And so one of the taglines for the Mind Your Risk campaign is that no one can lower your blood pressure like you. And so I think, as you mentioned, Dr. Myers, we really have to educate ourselves to develop what we call self-efficacy, where you feel like you can do it yourself. And part of that is having a good relationship with your medical provider, but also, educating yourself what you can do. Those behavioral things that we talked about, the exercise, the diet, cutting out those things that are bad for you. Unfortunately, some of those things are cultural for us in terms of the excess salt and the fried foods and those kinds of things. And men don't have these kinds of conversations, Melanie, as you know. So we need people to push us to do some of these things.
Yes, no, thank you so much for the dialogue and the advice and the honesty, and the vulnerability that you all have been giving. And so, as you are taking care of your health and taking charge, how has it impacted your relationships with your family members and your friends and your healthcare providers? I know, Eric, you said you've been looping in your friends when going for walks and exercises. And so for Eric and Dr. Myers, how has that looked? How has it impacted your relationships?
Well, I'll go first, Eric. It's as I kind of mentioned before, it's increased a lot of my interactions with my family, especially my father and my uncles. And so whenever I do go home, because they don't see a family physician, I've become the preventative health purveyor, and bring home, do the blood pressure monitoring, do the glucose screening. I don't do any diagnosing, but at least I can point them in the right direction of preventive health. Here are your numbers. Here's where we need to go, and things like that. So it's brought us closer in that way. And in that, I will say that they have tended to spread that word to some of their friends and things like that. So education and good habits tend to spread, and things like that. So I will say that it has had a positive impact on some of the men in my family. When it comes to the household, I do believe that because we are doing screenings in the house and we are doing talking about health in the house, it has led to a culture of health. And so when my son and the nephews, and they see that, they're asking, well, what is that? Well, what is mine? And so they'll pick that up and they'll carry that into the future about checking that and figuring that out and things like that, and start those healthy habits. So yeah, that'd be my takeaway. What you say, Eric?
Yeah, so just right on Facebook, some of the tips that I gave away from my own journey to my Facebook friends, their friends, things of that nature, they have, revealed themselves that, oh, my husband's blood pressure is this and he won't do X, Y, and Z. And then it kind of creates a group, not a huge group, but it kind of creates a group because, men don't like to be vulnerable. So, we'll start DM each other or something like that. And it's like, oh, I didn't know you was dealing with this. And I'm like, well, there's nothing to be embarrassed about. I mean, it is what it is. But at the same time, if you can, just like we're here today to share our stories and share our experiences, if you can share with somebody else, it can help somebody else, come out of the shadows. And I really think that a lot of my friends, family and husbands and things of that nature have done better because of me posting certain things on Facebook. There was one trick. I like to ask Dr. Benson about this. So I was taking something while I was doing my blood pressure treatment, and more so it was to help my pre-diabetic situation. And it really helped and it got better. So I was taking black seed oil, but when I told the doctor about what I was taking, their first response to me was, how'd you hear about that? And that was alarming to me. So what could you tell me about that?
Well, I think, yeah, I've heard about, that's a great point, Eric. There are a lot of alternative therapies. I know we're running short on time, and we have to do this again. There are a lot of alternative therapies that are out there. And I think there's definitely room for that. In medicine, sometimes we focused on just evidence-based practices in terms of what we say works. But I do agree that anecdotally, there are certain things that work for people to use. What I would say is that if you try that and it works for you, I think that that's good, but you have to continue to take your medicines, to check your blood pressure and see if it's making a difference in whatever area that you're working on. You don't want to just spend your money on something if it's not doing what you think it's supposed to do. But if you think it's working for you, I think that that's good. Unfortunately, what usually happens is people will say, I'm going to take the flaxseed oil and I'm going to stop taking my blood pressure medication. And then they never recheck their blood pressure. And then, we see you in the hospital.
And to add to that, there are naturopathic, practices that are and that are Black, that you can go see, to ask those questions too, that are licensed in those areas, to get an idea if you want a professional opinion.
No, I agree. And I do think that there's a place for that. And I think if it's someone that's trained and they are following your numbers, but you should seek someone out like that. And we're fortunate here in the DMV area to have people that are trained in those areas. So that's a great point.
But I reinforce, take your medicine too first, and don't stop doing that.
Right.
Fight the treatment, please. I was nervous about my kidneys, and that's very weighing on the mind. So, but I did it good for a little while. But
I do want to say though, you do have to worry. So just back to black seed oil, you do have to worry about it's a seed, and so whether it's organic, that. So I do want to say that. We probably have another question. It's probably out of time. But
No,
we do have
you're
to
fine.
do this again.
Well,
Yeah, you have to. No, thank you. This has been great. It's a lot of questions that I'm sure people want to know about. And so before we end our chat today, Dr. Benson, where can viewers go to get more information on this topic or find additional resources to help them and their family members and friends?
yes, so you can go to the Mind Your Risk website, and that's www.mindyourrisk.nih.gov, and that's MINDYOURRISKS.nih.gov.
Thank you, Dr. Benson, for highlighting those resources for those tuning in today. And so as we bring our discussion to a close, I'd like to extend thanks to both, or to all of you guys, Dr. Benson, Mr. Hodges, and Dr. Myers, for your insightful contributions today. Your expertise and your personal experience, I'm sure, has shed light on the importance of understanding and managing blood pressure, preventing stroke, dementia later in life, and just overall health and wellness. And so to our viewers, thank you for joining us and engaging in conversation today to commemorate World Hypertension Day. We hope that you found it informative and enlightening. Don't forget to follow our NINDS Brain for Life Facebook page for updates and more information on this important topic. We encourage you to share this event recording with your friends and family members to spread the word about the importance of taking charge of one's health. If you have any other questions or require more information, please feel free to leave a comment or send the NINDS Brain for Life page a message. Once again, thank you all for tuning in. Stay safe, healthy, and take care.